Good afternoon, welcome to Renew. Today we're going to talk a little bit about Sculptra. So Sculptra is what we call a biostimulatory filler, and all that fancy name means is that it's going to stimulate your own collagen. So it's a great filler for giving you pan facial, what we call total facial volumization. And we've got our lovely patient here today who has had Sculptra in the past, and the wonderful thing about Sculptra is usually you do 2 vials, 8 weeks later 2 more vials, and then once a year you just do 1 vial to maintain. So she's doing her maintenance now. But we just had a nice conversation that the Sculptra is going to just maintain her volume up here, but we're also going to do a little twist on it today. We're going to add a little radius for her jawline, just to give her a little more definition of her jawline. I love the Sculptra for building volume here, and we'll do the radius down here, which is also a biostimulatory filler. So it'll be a lovely combination for her. She's going to maintain her beauty and her volume so that as she ages, and she's a very active person, so sometimes active people eat up their fat. As she ages, she'll just keep this gorgeous face. Right now we're getting ready to inject her Sculptra, and you'll notice she has a beautiful shower cap on. It's all the fashion right now. But it's really important when you're doing Sculptra or any other filler that we keep the area clean. So I put people in a shower cap, it helps. So what we're doing, this is a cannula, it's not a needle, so don't get scared. It's actually got a blunt tip at the end, so that it's gonna, I've just made a little hole here. I'm gonna put that in, and then I can kind of safely move everything around and get it where I need it. The other thing about Sculptra is I will do this, not because I'm nervous, just because I'm keeping the product mixed. So she's already had her little poke here. We're just gonna insert this right there, and she might feel a little twinge of just kind of poking around. And just gonna put a little volume in here. And through this one pinch, I can put it in multiple different places. And we're just building up that cheekbone for her. And that's kind of all there is to it. I'll continue to move through around the face. I'm gonna do some out here. I'm gonna do a little bit in here. I don't want to give her too big of a cheek. And then, like I said, we'll do the radius down here to give her that definition. But already you can see the volume. The volume's going to go away in 48 hours. And then these little polylactic acid molecules are going to stimulate her body to get collagen. And she's going to, over the next 6 to 12 weeks, get volumization from her own collagen. So it's beautiful. So here we are, we finished half of her face with Sculptra, and I like to, this is our before and after. We'll do the other face, the other half of her face if she's nice. She's a sweetie, so we'll do it. So we've done this half of her face with Sculptra, and what you can see is that her cheek's a little bit higher here and much more chiseled. We gave her a little volume in her temple as well, so this eyebrow is a little bit higher than this one, and you can see she dips down here and she doesn't there. And then we've also lifted, so you can see actually her jawline's starting to look a little bit better. She's got some more volume here. It just, this side of her face looks nice and relaxed, and this side looks like it looks beautiful, but she just looks like she could use a little nice night's sleep. And was it painful?
No, not at all.
She kept telling me she couldn't tell where it was. She couldn't feel a thing, so.
Yeah.
She's a wonderful, wonderful client. Now the interesting thing is what we did up here in her temple is also going to help her crow's feet. It's going to lift her brow up a little bit and help her crow's feet. And you see her nasolabial fold is much softer on this side than this side. So this is all going to go away in 48 hours, but this is what we expect to see in about 6 to 12 weeks.